this is what the open method of coordination is kind of invented for. So the EU member states decided to work on the area of culture and health in the work plan for culture, and delegated voluntarily one expert or representative of the Ministry of Culture and one expert or representative from the Ministry of Health to discuss how best to form policies in this intersectional field. And we must admit actually that not all member states delegated both a cultural and a health delegate. This I think we have to accept. Well, most of them were from the Culture Ministry, but many member states actually did have their health experts, and we had quite many health input in the area as well. So I have here 3 delegates from the OMC group, so now we can use the abbreviation. Edith Perez, who is founder of Arts for Health Austria, Culture and Health Platform member, but in her capacity here now, she is actually the OMC delegate of Austria for the OMC group, Culture and Health. And Bruno Gallice is the OMC delegate from France. He is Cultural and Territorial Action Advisor of Auvergne-Rhône-Alpes, French, in representing the French Ministry of Culture. And we also have from Finland, Laura Norpa, who is a senior ministerial advisor on cultural affairs from the Ministry of Education and Culture in Finland. And we also have, of course, we should not forget Brula Barnoro Usi, who is a strategist from region Stockholm, Competence Center for Culture and Health in Sweden. And we thought that she would be joining this panel more like from the practical point of view, what happens on a regional level. Because one important thing to say is that I think around Europe 70% of the health funding is distributed on a regional level. So we definitely not only have to speak on member states, EU level, but also on regional level. And we also should mention that the Competence Center in Sweden is part of the Culture and Health Platform. It's very interesting how there are different versions of the platform members as well, but it's also super good to have like a region and seeing how it's implemented. So without further ado, I would like to give to Edith Perez, who is actually co-chair of this OMC panel and worked incredible on something which is called the OMC report on culture and health. Edith, the floor is yours.
Thank you, Kornelia. No? Hello, everybody. I just try to figure out the technique then. No? What do I?
You just push button, the next button down on the computer. So, yeah.
Yes? Oh, here. Okay. Don't move. Oh, thank you. And now here. Yeah, okay. Ta-ta-ra-ta! Now, this is the beast of the OMC group. I don't need to explain. Again, open method of coordination. So when we met the first time in Brussels, members of the health and culture sector to discuss culture and health for this report, we didn't actually know how to go about, because this was also a matter of coordination. How are we going to work together? How are we going to learn from each other? We had one premise. We had the work plan for culture, and we had the EU Council conclusion on a comprehensive approach to mental health, and these two documents were sort of the basis for the mandate, and the mandate was about finding out how the two sectors, the culture sector and the health sector, could work together. So as you have seen in the previous slide, there is quite a lot of work has been done on the European level. I'm not going to repeat that, but it starts really with the preparatory action Culture for Health report. That's a really important, that was a milestone in the development, and then followed several policy documents and papers. It was the first time that we had, that the cultural sector approached the health sector. And as Kornelia mentioned, the cultural sector on the representative side was outnumbered the health sector. But what was really surprising was the openness and the competence of the health sector when talking about the cultural input into the health side. So it was a very open discussion, it was a very lively discussion, and together I had the honor to chair this group together with a colleague from Greece, and we just felt that from this is the mandate, from session to session, the enthusiasm and the engagement grew. And so while we met twice in Brussels, the third meeting was already in Lisbon. Then we went to Riga and we went to Zagreb. And there we not only had our meetings, but we really learned the scene, we learned the practice of the culture and health initiatives in those countries. To arrive at the recommendations, which we formulate for the EU level as well as for the member state levels, we looked at the development so far, and we identified challenges, and challenges for the health sector, challenges for the culture sector. For the health sector, it would be financial challenges, but also the expected rise of non-communicable diseases, the detrimental state of mental health in the European Union, especially for young people. The challenges for the culture sector would be precarious funding or digital disruption. And of course, there are intersectoral challenges, like insufficient practical support and leadership of intersectoral collaboration, fragmented governance structures, which we have also talked shortly about. We are not talking about national decisions, we are talking about regional decisions, we are talking about local decisions. So there is always a very intricate network of decision makers in the health as well as in the culture sector. So our task is challenging, yeah, but there are opportunities. And we identified 21 opportunities for the health sector, for the cultural sector, but also for the global crisis that we are facing. Now, based on these identifications, we formulated actions for delivery and implementation. These would be to build and implement a European strategy, establish corresponding national culture and health strategies, enable intersectoral collaboration, design and implement culture and health programs, build capacity, advocate for culture and health, and strengthen the evidence base. Now, a lot of these things that I'm talking about here is already thought and delivered through the culture and health platform, which is a really good instrument to carry on the process that we have established in the culture and health report. Yes. With this group, I think we have come a big step towards the goal of getting towards a strategic approach, because we know we have a very diverse and fragmented scene. What we need is to bring it together, to really make a movement out of these particular and singular initiatives. Now, I think this we have come a big forward. The member states can now use this report as a reference, voluntarily follow its recommendations and adapt it to the local context and according to their systemic requirements. However, our work of the last 1.5 years shows that a closer collaboration could only be a win-win situation for both sectors. The content of this report is based on the practical work that we find in the field. We had a wealth of good practice examples provided by the delegates from the member states, and this will be explained in detail by Bruno, who collected and really put a lot of editorial work in these good practice studies. So actually, an applause to Bruno. But before I give you the stage, the report is now launched today in Barcelona by the Commissioner, Glenn Mikalev. This is the... and in the Civic Agora as a side event of Mondia Cult by a colleague of us also. So we have 3 launches today of the report that is not even public. I can't even give you the link yet because it just went online. But we can share it after the session. You get the links to the report and to the executive summary. The progress that has been made, I would like to shortly explain on the example of Austria, because this is our NGO. This is a small organization. These are our projects, and we will have a launch of the report in January in Vienna. And this will be the first time that the Ministry of Culture and the Health Austria, this is an agency of the Health Ministry, will work together to launch this event and launch this report. So this is an encouraging step. It doesn't make a solution to all the problems, but step by step we get there. And then, yes, don't forget, I hope to see you all in Vienna in January, but also next year in Vienna, there will be the next Culture and Health Forum, where we will proceed with the work here and with the work done in the OMC report. Thank you very much. Bruno, good practice. Thank you.
Hello, everybody. Just a quick words. As Edith mentioned, our group has lived an incredible adventure over the past months. And each meeting allows us to discover powerful culture and health projects. That's why we created a dedicated working group on case studies to look broadly across Europe, but also to understand how culture and health is already taking shape. We collected around 150 projects, and they show the wide diversity of approaches. Some recurring formats across countries and other completely new. Everywhere, people are committing to culture and health, and the timing of this report feels right. The time to act is now. So we wanted to bring the energy of these encounters into the reports. That's why case studies play such a central role and a vivid entry. We had about 45 highlights presented as focus, often with quotes from professionals or beneficiaries. These voices show very simply that it works. Some themes are already very present all over the EU, such as aging, cross-sectoral collaboration, prevention, culture and prescription, or even Arbrut. And let me, just to give you a glance on the report that you're gonna access in a few minutes, just let me share with you 3 projects that illustrate this diversity. First of all, in Brussels, the Maison Gertrude is a social retirement home that is now hosting a contemporary art center. Artists in residence work with health professionals and residents, and the home has been transformed into a place of creativity and life, which welcomes visitors to various exhibitions. Similar models exist all around Europe, like in Lisbon, like France, like Austria, and the result is the same every time. Life returns, eyes lights up, and spirits awaken. In Riga, Latvia, we saw another great example, because when we talk about culture and health, we often think about dance, music, cinema, but we wanted in this report to emphasize another way to deal with culture and health issues. So in Riga, in Latvia, the children's hospital was redesigned by architects and designers, and it was quite a shock when we visited it, because the light, the colors, and the materials all contribute to ease anxiety, to ease, to feel better for children and parents. And it's a very subtle art which goes to every single details, but a very powerful example of design as part of care. And finally, just a really subjective example from France. In France, here we've got a photographer called Nadine Barbanson, who worked with isolated old people in mountain villages, using photography to create connection, dignity, and joy with present. So, beyond showcasing project, the report advocates for stronger public policies to support culture and health. Existing frameworks at local, regional, or national levels are good examples as well to inspire policymakers. France offers an example this year with its third National Culture and Health Convention that was signed in July 25, which sets goals for the next 10 years. Just a moment. Yeah, here are my notes. So, for like 20 years, the two previous national conventions established programs in hospitals, but also in nursing homes or social facilities. This third national convention set new ambitious goals for the future, like a more precise working contacts with regions or cities, increasing visibility, linking with research, and opening new paths such as prevention or cultural prescription. In my own region, we support 100 projects each year, and some hospitals have developed artistic and cultural season for patients, staff, and families with professional artists. What I see every time is that cooperation is essential, co-design. The worlds of art and health don't really speak the same language or even follow the same rhythm. That's why we need time for easing, to ease the dialogue and co-design, and that's why co-design is so important. In a true culture and health initiative, both sectors work together, crossing their perspective and expertise. That's why we regularly organize local meetings between professionals from both sectors in order to exchange, to learn, and dream together. And yeah, here we got for me kind of like the recipe of a good culture and health project. And it's quite simple. We need time, we need dialogue, we need fundings, obviously. But we need as well like a touch of creativity, because culture is a right, and we are talking about cultural rights, and our responsibility is to make sure everyone, whatever their state of health is, has access to artistic and cultural experiences. So this is just a glance of what you're going to see in a moment. What a teaser. And I'm going to let Laura talk to you for the next. Laura, please, hold on.
Hi everyone, my name is Laura Norppa and I come from the Ministry of Education and Culture, and I've been a member of the OMC group together with my colleague from the Ministry of Social Affairs and Health, Heli Hätönen, who couldn't unfortunately be here. But you heard Taru Koivisto in the morning giving the opening speech, and Taru is also working with us on these issues. So today I'm here to just give you a glimpse into the Finnish structures of culture and health and how it works on policy level. Yes, and I work in the Cultural and Arts Policy Department, and culture and health issues is one of my responsibilities, together with other areas as well, but yes. So, I'm not going to have a lecture in history, but just to give you kind of the view on how we are here. We are now here in the position that culture and health is part of health promotion and health preventive measures. So we have it in the government program. We have kind of a clear framework for culture and health issues in that sense. And we have already quite good, I would say, structures and collaboration forums, although there's we have a long way to go, even to make it even better. But just to say that we have come to this point, and why we are here is, I would say, thanks to this guiding principle that we have in Finnish cultural policy ever since the 1970s, that culture should be accessible to all, and that has been a strong belief into the democracy of culture and how to democratize culture. So that has been kind of the link between culture and the well-being, because there has been this belief in culture being good for the people and good for the citizens on a general level, not maybe talking so much about health, but well-being and participation and inclusion. So we have that kind of history when we look at the policy level. But then, coming into the 20th century, then it really started to kind of kick off this kind of health and culture and art interconnections. So we had the first time where culture and health were in the government program, which is a very important strategy document for us, and it guides the work that we do in the ministries, every ministry. So we have culture and health in the government program since 2011, and that made a huge step and a huge difference for this sector, as the cross-sectoral, intersectional collaboration between our two ministries, education and culture and social and health and affairs, started. And what I find is a very important kind of organ or a form of this policy work is our expert group called Taiku in Finnish. So it's a culture and health expert collaboration group, and it has now been, we have different group formations every 4 years. So we have the government program for 4 years at a time. So now we have the 4th Taiku group, and in this room we have members who have been part of these Taiku groups earlier on, and they have, so different members every time. At this point we have quite a high level, a policy level memberships, and recently we had, or before we have more grassroots and NGO representatives in the group. But let's see how it will develop in the future. But this, as an example, I think is a really good way of kind of institutionalizing the collaboration, having the ministries and having the grassroots actors coming together and driving the change and setting the strategic objectives. Yes, so just briefly about the financing, because of course, as for all of us, it's a big challenge still. But we have some structures in the financing, and even more than I can share with you here. But we have kind of the ground is set, and as from 2016, we have had Taikusydän, which has been the most kind of the focal point for culture and health issues, together with Arts Promotion Center, of course, who also have had or has still experts in these issues. So then the financing from the social and health side is equally as important, of course, as Edith said. It's a win-win situations, and also the financing should kind of reflect that. So we have had in the couple, let's say the decade, a decade ago, we've had quite a good situation in the social and health financing. So we have many long project periods with euros coming with that. So you can see there, I won't read them all, but just to give you a glimpse that we have kind of this dual financing system, but it's still too volatile, and it's still too project based, but we have it, and we have something to work on, and very many good initiatives have come from these financing calls. So now we're here, we have the OMC report, and we're very happy to have it, and we think in the ministry that it's very important, and the ministries actually, it's very important that we now have it on the EU agenda, like really solidly, and we will continue to work on it, especially in our Taiku expert group. So we have the recognition of culture and health connection. And we also have another important policy document just now recently came out, the government cultural policy report, kulttuuripoliittinen selonteko in Finnish. So it's a very central document for us. It's giving us the whole cultural policy scope. It's not only culture and health, but culture and health is one part of it, but kind of the strategy and vision for culture policy in Finland until 2040. So it's a very kind of this forward-looking document. But there we have this, how would you say, like it's there, it's written there in the report that we recognize that the importance of culture as part of health and social services and preventive actions, and especially in combating loneliness and reducing segregation. So it's there. And now the next step is then that we're going to build on an action plan. So we have the report, we have the theory, we have the framework, and then we're going into the action plan. And it's very much just starting the process. We had the first workshop for us working in the Ministry of Education and Culture on Friday. So this kind of real brainstorm workshop, and another one is coming up for the stakeholders, where also Taikusydän is invited, and many other interest groups from the whole cultural and art sector is going to be in mid-October. So it's really like now starting to developing this action plan. So yeah, we see how it goes. Yes, just a couple of closing words. We have a really like a huge amount of expertise in Finland and know-how, and we have the experts, we have the artists, we have a lot, but we still need to get it into even better use. And we have challenges with the well-being service counties and the economic prerequisites. They have they have very different resources to use on health prevention. So it's hard to make a kind of an overall aim for it, because the resources are so unevenly uneven throughout the country. And of course this, which is mentioned many times, the project-based financing and project-based operations. So how to build lasting structures, and it's something we work on in cooperation with everyone, Taikusydän, not to mention. And and finally, maybe just to state the obvious, that we need even more evidence base, although we have a lot. But what I've heard from my colleagues in the social and health sector, they say that we still need more, and we need more systematic follow-up on the effects in order to convince the policymakers on a level above us to make a case that we really need culture and health. Thank you.
Okay, so I'm the next speaker, and I think that I might repeat a lot of what has been said, but I'll try not to, and I'll try to speak from our regional perspective. I'm going to speak of the status quo of the arts and health field, but from the perspective of Region Stockholm and the Competence Center of Arts and Health. I'm also giving a short historic recap because a lot of the work that has started in the arts and health field was targeted towards the elderly, and it was a research program called, this is my English translation, of course it has a name in Sweden, but Culture as Care and Care as Culture. And this had a strong political support from the Christian Democrats that usually drive questions of the elderly and healthcare issues. And it had a strong support, and it was ongoing for maybe more than 10 years, and this was widely recognized. They even went to Japan and tried to implement it there. So it was like internationally acclaimed and really asked for. And this was really structured. It was a structured research program. But we soon saw that there was a wider intention needed because, of course, as you all know, we have so many public health issues. We know that you have issues of mental illness going down the ages. Many young people are suffering from mental illness. We know that, especially during COVID, that in Sweden, I don't know if it's the same all over, but we have lots and lots of problems with isolation in the elderly population. So many elders are being left alone, and like the suicide rates, especially by elder men in Sweden, are really, really high, and many think that this is like, the reason for it is involuntary isolation. So we started working about, okay, it's really good that we do this for the elders, but how about everybody else? And during the same time, we had also different universities and different researchers from different fields starting like Dance for Health programs, doing this also structured with evaluation, etc., and seeing like that the evidence was already there. So, and at the same time, like arts on prescription was being tried out with really good results in the Stockholm region. So we thought that, okay, the potential in this field is huge. Where do we start? How do we do this in a structured way? And of course, there was no structure. So we had fundings for projects, as usual, as everywhere else, but not for this structured long-term work. And this final thing in this short historic recap was that in 2012, the Swedish Art Council did a mapping of all the arts and health programs all over Sweden, and saw that there was so much being done in the country, but there was no structure or no like organization on a national level. And they did, of course, the recommendation that we all know, that what we need is collaboration, learning from each other, not reinventing the wheel, not working in projects, etc., etc. We're all preaching to the choir here, but yeah, that's what we see. In Region Stockholm, we have special grants for the arts and health programs, for projects. It's more or less 1 million euros annually and a bit more in certain years, and artists can apply for this. And we also, some of this budget is also the budget of the Competence Center for Arts and Health, where we do like research, evaluations, and we do like sometimes innovation projects also. But we have tried a lot of things, of course, like Dance for PD, Dance for Health programs, for different groups, arts on prescriptions, for like asylum seekers, for the elderly, for people with pain management issues. And we also, while doing this, we also had something called a culture catalog for the healthcare section. So they could like go in and order an artist to come and do something with them. So it could be like, I want a musician to come like for Christmas and maybe do Christmas caroling for the elderly, and they could order that. But the flip side of that was that it was always going to the same caregivers, because once they found out this possibility was there, the first one who registered were always the same, and that created like an inequality in who got these programs. And it's more or less the same also with our fundings. We see that a lot of money goes to the clowns, to VR projects at different hospitals, and like where the structure is already there, they get the money. So that's why the Competence Center works a bit differently, so that we can bring it to where it's most needed instead of those who are already like they are already part of the choir. We like as a region, we also have a mission to reduce inequality in health. And in Region Stockholm, we have like a regional public health authority, more or less. And they could see that from the richest areas in Stockholm to the poorest, and it's the same subway line, you have like an expected life span that differs 8 years if you are living in a rich area or if you live in a poor area. Yeah, so you have like huge inequality in this super small geographic region, but with 2.4 million inhabitants. So especially for us, the Competence Center got its money from like the health administration. It was really important to try to target this inequality in health issues. So we have some of our projects are preventive towards areas that are geographically more challenged, if you say so. Yes. So this is more or less our model of work, if we could say. So we have like the patient groups are already part of us, because Region Stockholm, of course, offers health to all its inhabitants. And we, as a competence center, we know what art forms are in use, we keep track of research, and we bring in the collaborative partners. And those can be artists, researchers, universities, centers for knowledge, as we call them in Region Stockholm, because we don't only have like a regional public health authority, we also have like research centers towards psychiatry, towards epidemiology. We already do that, so we try to like bring everybody together and start doing research on this. And what we have seen is that innovation, co-design is what works, but bringing in research as well. And through all these years, we see that there are positive outcomes, not only for patients or caretakers, but also for the caregivers, because many of our partners say that this is like, especially in psychiatry, they say like this reduces ethical stress for the caregivers, for the personnel. They feel like in psychiatry, they speak about a therapeutic alliance, that it becomes stronger because they get to see the patients not only as patients, but as whole human beings, since all arts like departure from the creative and like the own agency. of the patients. And we, for now, we have our politicians on our sides. They think that this is a really good idea and they want us to upscale our work for now. We have a momentum today, I would say, in Sweden, even though we don't have a national organization that structures everything. But the national public health authorities, I stole it from their webpage. So Folkhälsomyndigheten is the national public health authorities, and dinpsykiskahälsa.se is yourmentalhealth.se. And here it says in Sweden, like cultural activities such as music, dance, theater, or creative arts can contribute to your health. So we have many allies, but nobody owns the question on a national level. We also have the National Board of Health and Welfare. They recommend in some of their strategic documents art therapies for different patient groups, like in palliative care, both for like normal palliative care for adults, but also for children. We have a national network for culture and health in Sweden. It's informal, but it's very important, and all the regions are represented there. We have allies also in the medical field, because there is an association for narrative medicine, which is like an organization driven by doctors. So they see the importance of this, and we have a lot of universities or higher education institutions that work more or less in this field, but not as a national mission. So where do we stand? For us in Region Stockholm, culture and health is mentioned in the strategy for sustainability. So at a regional level, they see this as a really good target or a way to work with social sustainability. We are inscribed also in the strategy for research, education and development. And the regional board, in its budget, dedicated like specified money for us and said that we have to upscale this work. So there is a momentum, even though we can't do that much. We also, during these last 2 years, we have been invited to speak at like the health conferences. So we have been to the National Conference in Palliative Care, speaking about how culture can contribute to palliative care, but also to the National Congress of Psychiatry Research last year. And I also have to say that we are absolutely not the only region in Sweden doing good work, because there are regions in Sweden that do fantastic work, but also with less funding, but maybe in a more like specified way. We try to do this as an innovation hub in order to also foster new knowledge and try to spread existing knowledge. And next week, me and one of our artists are going to a hospital at Region Uppsala in order to give a speech about like its competence skill days for the medical staff, where we're going to speak about how culture can contribute. We have lots of research projects and innovation projects, and yes, we work with co-design. But we have also come to a point now, because when the Competence Center for Arts and Health started, we had to go to the caregivers and like offer our collaboration. Now we have a momentum where they come to us. So we think that like on a social level, something has changed. Like the recognition of culture or the arts as a motor for social sustainability is there, I hope. At least that's how we want to see it. More work is needed. I think that I already talked about that. But we see that we not only need areas or like possibilities for artists to meet. We of course need that, such as this day, but we also need to have like platforms for caregivers where they can speak their own language about what they do and their effects, but also for researchers working in this field. And maybe like have this discussion about what evidence is in a medical perspective and what it is in the humanities, because it's not the same thing. And when we try to say that there is evidence, because I'm a humanist, for me it's like it's crystal clear, of course this is evidence. But if I would go to a doctor and say this is evidence, they would say, but you can't measure that. And we also have plans, and I hope we will be able to do that, but we want to work with the Stockholm School of Economics also to start doing like health economic evaluations on this, because if we could show that this also benefits the society, like on a numbers base, that would be great. And thank you. That's all.
Thank you so much, dear panelists. And again, just to state how grateful we are that actually we are here in Finland, and where actually I think that's the only country which on national level has such kind of a structure, and also that the well-being of citizens are put in the forefront. But also I must say, yeah, also Stockholm had wonderful examples, and also France. But what is important to know is that there are huge, but really huge disparities across countries, and in many countries it's like they don't even, like not even heard of, let's say, while we really see so many initiatives here. So I was first thinking, do you have, I saw some people were nodding here in the panelists, sometimes you made notes. Do you have some reflections on what you have heard so far from the others?
Yeah, I think that that's an important point, that we are in Europe on different levels from one state to the other. And that's why these OMC groups are so important. It's to learn from each other, to get to know other methods, other strategies. And I think I found one thing that we were agreed on in the OMC group, and that's the premise that we departed from while writing the report, was that actually culture and the arts, to engage in culture and the arts, is a health behavior. So like we have seen that with Christina this morning, when she said, oh yeah, you do sports to be healthy, but what about the arts? What about culture? And I think we are now in a mental health crisis. And if we say that sports is good for your physical health, we can make the claim that culture and the arts are necessary for your mental health.
Any feedback from your side? No?
As an ex-researcher from the humanities, I think I heard somebody, an artist, speak about that earlier today. I think that we are really good at saying that the arts do have like positive outcomes, but I don't think that we speak enough about what in the arts it is that like brings everything into motion. And that's when if I go out with a like caregiver and do a speak, I normally always depart from that. Like, what is it? And I try to translate that into something that everybody can understand. So it's about playfulness, it's about co-creation, but because we normally don't think about that when we go about, but like every time you listen to a piece of music, or you read a text, or you see a visual work of arts, something goes on inside you. You start interpreting, like there's an interpretation process going on. So you have, it's basic things, but I think you have to say them out loud in order to make this comprehensible for everybody else. So I think that that's a weakness, because if you start speaking about that, you wouldn't end up in the trap of the instrumentalization of the arts in this, I think.
Yeah, you wanna?
Yes, thank you. I totally agree on that specific point of view. And that's an issue we tried to challenge in our report, and because of Kornelia said this morning that we discussed as well about the word for or and definitely our mandate was culture and health. So we were really aware of this specific challenge issue and wanted to avoid that the cultural sector to be the instrument of the health sector. So definitely, and I think actually the cultural sector has to be proud in a way and say it out loud that he does matter, and he can, not only for heart's sake, but for the benefit of the whole society, he can go forward and maybe make the difference.
Yeah, I thought it was really well said when you said that you need evidence, like different kind of evidence to different interest groups somehow. Yeah, so that we can, how do you say, like make a case for different policymakers. For instance, I work a lot with policymakers, so we can say that culture and health is good because this and this, and then for another audience we can present some other evidence. Well, actually, I feel it's a bit like tiring to always talk about the evidence base, but I think we still need to do that.
Yeah, all the more so because we have a question already. That's exactly. We wanted to open the floor anyway, so thank you, Inza.
Is that okay?
Yeah.
Hello, I'm Inza from Berlin, from the Healing Culture Network, and also a partner of the Culture and Health Platform. I just wanted to include that I think it's very important that the arts or artists are not instrumentalized, but on the other hand, I think it's also about enabling the medical world again to do, to open up into their former state, also doing, I mean, in German you say Heilkunst, and that was kind of, healing is more than putting some medicine into a body. So it's also about enabling the doctors and the nurses and the caretakers to engage with culture and arts within their field. I mean, I think exactly, it's one field. It's not one field here and one field there. It's the same. It's a common field. But I think we agree.
It's very funny. Thank you for everything you shared. It's just a question because I think we all agree that we need evidence-based research. We need to be able to talk about what kind of impact those projects have. But I think what we struggle with is to identify the proper indicators. Because very often when we get to that point, and we've worked on it for years now, but either some people will go towards therapeutical indicators in terms of, okay, people need less medicine or get better sleep or whatever. Or then what we try to do is to find the right indicators for what does it create to have a space where people will feel considered as a human being before everything else. And those indicators are very tricky to identify, and then it's also not always what people in the health sector are waiting for. So how do we convince people with like general indicators that are not explicitly the ones that they're looking for? And I think it's the struggle in terms of communication. And also one last thing is, we often think about the indicators in terms of what happened for the patients or the people who are supported. But those projects are not only for those people. Those projects are also for the professionals in health organizations. They're also for artists. And I think we need to talk more about the impact that those projects have on the entire community around this project, because it will make a huge difference and it will help us consider all those different impacts as well. And because I think it will orientate the project to come, if we only think of the impact on the beneficiaries, to say, or if we think of the impact on all the different kind of people that can be involved and go through the project.
Okay, so I'm going to put on my artist hat and I'm going to say, in my heart, I absolutely know that the arts impacts health. Now, when I said exactly those words at a conference in Austria, I had all the health people want to jump on me and kill me. You were there, you saw it. I then had to declare my PhD in public health and master's in epidemiology before they would, get off me. But when it comes to quantifying, if it's arts and health, then we have to also respect the way that health does things. And health, if they want it quantitatively, then we need to provide it quantitatively. Otherwise, it's just arts, and we're just talking to ourselves. So when I first said I was going to quantify the arts-mental health relationship, health were like, great. Arts were like, you're going to ruin the arts. And yet now, what's the thing that everyone's using? The dose. So I think it's actually about bringing our skills together. Because there are things that, as an epidemiologist, I can't do. Or when I say evaluation, I think we have to move to quantitative evaluation. We need the qualitative and the quantitative, both are good. But until we have the quantitative, health are not going to listen. So it depends on whether we want to keep talking to ourselves or whether we want to talk to health as well, whether we are going to have the collaboration. And when we got money for good arts, good mental health, it was because we talked health. And we can, it doesn't need to be separate, it can be both. But that's just me being controversial because I am also 50% artist.
Well, I think on global level, what we see being changed is that just in May 2025, the World Health Organization Assembly came out with this, I don't know what exactly the name is, statement, but so it means each and every World Health Organization member agreed to it, how social connections are important. And culture contributes to our mental, physical, and social health. Are they separate? No. But I think bringing that area, the discussion, while in health a lot of times it's like, okay, you are a person with Parkinson's disease, therefore you would have this and this, but how about all the carers? How about the angry carer or mother who has to take care of that person and then shouts with the children? So it's all a snowball effect. But yeah, I saw both of you wanted to speak, so.
No, I would like to.
You speak in your microphone and then reflect.
Yeah, I would like to hear this other lady and then.
Okay.
Thank you. I tried to make it short, but I originally had a comment, and now I think I have already 5. But I'm Pilvi from Finland, and I'm doing my PhD in public health, in arts and health, and arts in public health context, researching well-being services counties at the moment in Finland. A lot of what Laura said, a lot of links in that. But last May I participated in arts health research intensive course in England, and got the wonderful opportunity to work with Daisy Fungord and Katie Warren, for example. And I'm really thinking of the framework. Probably quite many of you know INNATE, and I was wondering if there would be a possibility to, or maybe the report that we haven't seen yet already has some ideas about this, that we would have European framework. What are the mechanisms? We know that there is aesthetics, activating imagination, activating bodily senses, and so on. So we do this work from week to week and year to year in all the countries, and we struggle with the same questions. So if we could have a European framework of arts and health, and that would be evidence-based, well done, and so we could kind of move on and say that this is our framework that would be broad enough, not just specific examples, but would be evidence-based. And I was so happy to hear that comment that the artist will kill and the health professionals will celebrate. So we kind of, I would like to cry and laugh at the same time, because we have the exact same challenges in Finland and in exact same challenges in art field. I've been managing 20 years in a cultural center, and I know the work in practice, and now I'm looking at from the policy and the research side, and I'm like, oh my God, this is same stuff from year to year. So let's make a framework.
I'm all with you. Yes, and for instance, in the International Association for Dance Medicine, IADMS, now they are not working on the framework but on benchmarks, and they are working in a dialogue with the medical profession to see what do they need, what do the artists need. So it has to be done in a dialogue, and I also think that we keep repeating this evidence base, and I think we have to get out of it and say, this is our framework, this is the way we handle that. And it will not be a medical evaluation, it will also not be a social science evaluation, but all these factors will play into our evaluation, because we are working on the psyche, on the physical body, and on the social body. So.
Because we have lots of validated indicators and meters, so why don't we just say that use WHO 5, SYB 10, could have social inclusion meter, that's Finnish wonderful new indicator, so we kind of could have ideas that maybe you could use these, for example, so they kind of, there would be like an affordance for those.
Yes?
Brula.
We need to get together and formulate it, yes. I think it's all there. It needs to be pulled together, yeah.
I want to disagree a bit with you, Edith. Now I will I will create some drama here. No, but we have now a couple of projects where we have like allies that are doctors, and we not only work with mental health issues, but we have also started to move towards somatic diseases. We have, for example, now a project with stem cell transplanted patients, in which doctors are really interested in doing this research, because we already had a music therapist doing her PhD on stem cell transplanted children, and she could show that she did also like a randomized control study, so she had a control group, and she could show that like measurably that the stress markers and the blood levels, etc., in the children that received music therapy were significantly lower and over time. So I think that we should not exclude the medical parts of this, because I think that there are doctors and nurses and medical staff also having an interest in this field. So I think that we should maybe respect that there are different evidence concepts and not try to force the one on the other, but also see and realize that this is not only interesting from a health point of view, but I think that many of the artists that we collaborate with say that this has like been an exceptional artistic experience for me, not only as being an instrument for the health sector, but also an artistic exploration that has been like beyond my expectations, actually.
That's wonderful. I would never ever exclude anything on the research.
I just wanted to create some drama in this panel.
Let's go into it then.
Yeah, and
so,
building on.
But I think what we are referring to is there are so many projects, and everybody has their own evaluation strategy, and it doesn't add up. It doesn't create really the evidence that we need. And for these instances, I think we can have a benchmark or a framework that we can apply very practically.
Well, I do have some good news that actually there was a Horizon call on creating this strategic discussion also on this, but also including parties and policymakers. And one of the requirements was about having this general evidence base that could be replicated elsewhere. So therefore, the amount of data, if somebody would put it together, then it could be also quantifiably convincing for policymakers. But also building on what you were saying, I think it's very important not to forget neuroscience. And these biomarkers and so on, they directly see the effect on the brain. And it is a very fastly emerging field as well, and neuroaesthetics. And maybe through that also we will speed up a little bit.
We also have that in Sweden, because Karolinska Institutet has a center that's called like the cultural brain. So it's culture and neuro. Unfortunately, they don't have so much money, or as much money as they would like to, but there's an ambition also there. So hopefully there could be.
It would be nice to get actually the two together, because I think there are a set of researchers talking in this circle and a set of researchers talking in that, and of course some do talk to each other, but more needs to be done there, yeah.
To give you an idea of how diverse and how beautiful this scene is, at the same time that we are sitting here in Switzerland, there is a congress on neuroaesthetics. So it's really, we're tackling the issue from many, many sides.
Our QR code has just gone. Yes, and meanwhile you might have seen that we have actually the OMC report now online. It is on the European Union's Publication Office official website. And of course, we very much hope that it's just the beginning, and it's also a way of countries trying to navigate in this area, but also learning from each other. And to be honest, one of my dreams would be to have a lot of learning visits across policymakers, across health sectors, because there is so much we can learn from the Nordics or from UK and so on, and definitely we should continue that. You wanted to say something?
This is the official launch of the report now. And
but we are.
If you don't want to go through the 100+ pages, there is also an executive summary.
Yes. I think we have to close now, and I can have some more questions if it's allowed, but we were told to finish a bit earlier because some practicalities. Do we have some time for one more?
Short comment?
Yeah. Let's go.
Thank you. I'm excited for these scales that everybody will be using to prove all we were talking about. But I wanted to ask about, because the example of Finland and the collaboration between the ministries is impressive, and I really like it. Just to understand, I'm from the Czech Republic, and we have separate ministry for all of these things. You know, there's a Ministry for Social Affairs, Ministry of Health, Ministry of Education, Ministry of Culture, and it's very difficult to get the people from the different ministries to come and work together. So even seeing that in Finland you have some of these combined is great. And my question is, how is this protected, you know, like from the legislative perspective? Because what happens in the Czech Republic is that after each election, it's a different party that's controlling each of the ministries. So what if in Finland, in the next elections, there's somebody who doesn't agree with supporting these ideas?
Yeah, of course. We also have the government changing every 4 years with the elections. But we have us, the civil servants who are working at the ministries, so we are kind of giving the long-term objectives and keeping up the aims. So of course we can sometimes feel that the politicians aren't always on our side, but we do our best to keep kind of the overall policy aims there all the time. So we have the same kind of the 4-year structures, but then we have the civil servants, us working at the ministries. who does kind of the everyday work and from year to year. Yeah, but I can see what you're talking about. It can be a challenge, of course.
And maybe just a point. I think, yeah, long-term partnerships or convention like we do in France are really important. A 10-year convention means that we will have 3 different presidents and even more governments. and the second point is maybe the link between the national strategy and local or regional strategies as well, and the way to policymakers and politicians can dialogue between those 2 levels of competence. Because even if at a national level something goes wrong or doesn't improve, local initiatives and regional governments can still go on, and go further, or vice versa.
I just want to say that find allies in the different sectors. That's my advice, to find the good people who want to work on these issues. Then it will go far.
And then every, let's say, 4 years, you have the cultural strategies changing. Make sure that has it in there. And then maybe just 2 years later, the health strategy changes, and you have to be aware that it's actually changing and be there and tell it to them. This is missing. I think that's a nice way to round up. And I'd like to give the floor back to our moderator. Yes, thank you.
Thank you. Thank you very much, Kornelia, Chris. Edith Perez, Bruno, Gallice, Laura Norpa, and Rula Ossi. Very engaging discussion you had here, conversation. Thank you all for participating. We're going to break up soon, and just a reminder that if you're not going to continue here in the Siegen Hall, find your way to where your space is, the workshop, and presenters, please be 15 minutes early, so that's at 2:30. And just a fun fact, we Finns love to drink coffee. We drink more, we're the world's best coffee drinkers per capita, so it's time to have some. Let's have some coffee. Enjoy your coffee break, and we'll continue our sessions at 2:45. That's 14:45.